Welcome back to Takacs McGinnis Elder Care Law Hour. I'm your attorney and co-host, Tim Takacs. Today, for our final episode, we are re-airing some of our favorite segments from the past 3 years.
And I'm Barbara McGinnis. This is going to be our last segment, and we're going to hear from Dr. Love Anani talking about advanced directives in the emergency room. This episode, or this segment, we're going to be talking with an emergency room physician. What happens when you show up in the emergency room? Sometimes that's the first time you think about an advanced directive. What do they need to know? Dr. Love Anani is the emergency room physician from North Crest, which is in Springfield, Tennessee. Good morning, Dr. Anani. Thank you for being here.
No problem.
So when somebody shows up in the ER, are you actually thinking about advanced directives? What do you do first?
The first thing we do when people show up in the emergency department is take care of them. We have to figure out what the problem is, and once we have a problem and we can identify it, then we start to think of a solution. So before we start thinking about advanced directives, I need to know, what am I solving exactly?
Yeah.
Right. You're doing what, triage or whatever it is that you all
Exactly.
call
Those
it.
ABCs we hear about all the time from the first day of medical school. Is the airway okay? Are you breathing okay? How's the circulatory and heart system doing?
Right.
And once we know all of those are stable, then we can move on to, well, do we have some advanced directives or guidelines that we can follow and make sure that we follow the patient's will?
So what if there is not an advanced directive, or you don't know that there is one and no known person has a healthcare power of attorney? Basically, you're flying on your own.
When we're flying on our own, we like to put things in an autopilot, like most pilots, which is doing what's ethically sound. So we will do what's best for the patient and what's best for the family. So in most cases, that is placing people on life support, because we as human beings deem life better than death, which I personally appreciate myself.
Right.
So in those cases, we will always do that first, unless we think it's just a patient who's in a terminally ill status and has a terminally ill disease, or the wound or the emergency is just too fatal. Sometimes we'll deem that more ethically appropriate than, several hours of CPR or breathing tubes.
Right.
To what extent does age play a part in decision making? Does it affect that?
Age does affect it, and it sounds harsh to say it sometimes, but only affects it when we're trying to do what's best for the patient. So in examples I like to use, your aorta, which is a very large blood vessel that carries the majority of blood in your body. If you're 98 and there's a hole in that, the surgery to fix that can be very long, can be very rough, and can put your body through kind of a worse state than that it's actually in. When you're 28 and there's a hole in your aorta, you can survive that surgery and get back to a full life. So sometimes we do use age as a factor into what intervention we want to do next.
That's just calculating probabilities, I guess, just what you would ordinarily do anyway as a physician.
And we always like to say, we have to assess the risk and the benefit has to outweigh the risk every time.
Yeah.
Okay, so someone has, and we're playing riddle this now, doctor. So let's say there is a healthcare power of attorney because the patient walks in or comes in, and he's got it in his pocket, and you're trying to call somebody and you can't reach them. What do you do then?
Well, if we try to call and we can't reach, sometimes we hope there's a second person listed.
Okay.
But if there's not, again, we will do
doing the same thing.
Still do what's ethically sound until that person arrives, and then they can start giving us direction from there. But we want to make sure that there's somebody still there and alive when that healthcare attorney or agent arrives in their place.
Right.
Well, can a family member make a decision for someone that would supersede a document?
Yes. Usually we actually lean on the family for decisions, but it depends on what they're trying to supersede. So if somebody the day before signs a do not resuscitate form, and then I see them the next day and they need to be resuscitated, I usually follow the form in that case, because the family member, if they're not listed as the healthcare power of attorney,
May not even know.
If they are listed as the healthcare power of attorney, I'm going to follow them because they're supposed to be the person who knows the patient the best. So in those cases, we will lean on the family member more. But if they don't know, then I will go with what the patient signed and thought was best for them when they were in a calm state.
Right. So that kind of like begs the question then is, suppose that you've got someone, a patient comes in, and obviously maybe the patient is non-responsive, and then you've got a healthcare power of attorney which says this or says that or an advance directive, and the patient's representative, the healthcare agent, wants to do something else. Can they do that?
They can do that, because you have put your full agency in that person over the document. A lot of times documents can become old. They can be signed 2, 3, 4 years ago, and things can change. And we hope that healthcare power of attorney or agent not only knows you best, knows your situation best.
That sounds like a good thing.
It sounds like a good thing. You'll be surprised. We trust humans over documents and papers, but we really like to make sure they know what they're doing. So it will be a long conversation. We will make sure to go over every single risk and benefit with them and make sure that they have all the information necessary.
And because families don't show up one at a time and stand in line and go, I'm the first person you need to talk to, Dr. Anani. How do you make the decision? I mean, you're standing there looking at maybe a group of people. Who do you listen to?
Well, in ethics and the state of Tennessee, there is a hierarchy, for lack of better words.
Okay, good. We need to know this. I think we know it, but I think our viewers need to know this.
I like to follow the simple form. Healthcare power of attorney is number one. So you could have been the wife for 50 years, but if the first daughter was named healthcare power of attorney, that's who we're going to follow.
Gotcha.
Then next will be spouse, and then next is usually eldest child, and then sibling, mother, father, going on down that route. So we tend to follow that order, but if the youngest daughter is the person who arrives first, and I need a decision in 5 minutes, and the wife's 10 minutes away,
you're going to do that.
I'm going to do that one.
Gotcha.
Yep.
Yeah, because I understand, or we understand that that under Tennessee law, that the physician or the provider can actually pick somebody.
We are on that list ourselves as physicians and healthcare providers, and we can pick someone if we feel they not only understand the risks and benefits best, but if they have the best level of comprehension. So if your wife is there, but she unfortunately has Alzheimer's, I would think in that case the oldest child would be the best candidate, and I will follow their direction over the wife's.
Right. And I guess you note that down and whatever. Most likely you're going to do that, or you're going to chart that.
I like to believe whatever I chart, 5 lawyers will be reading it afterwards, and I document as such.
Yeah.
Well, so as lawyers or as potential patients in an ER one day, what can we do to make your life easier?
To make my life easier, I like to say you have those forms, you have them available, and everyone understands why you chose what you chose on those forms. So whenever you go to update those forms, contact your healthcare power of attorney, especially if they're not in the same state or same city. Let them know, hey, I've updated my form this month or this year. I don't want to be resuscitated. 2 years from now, you're allowed to change your mind and say I do. But make sure everyone's aware.
Right. And it sounds like what Dr. Dallas said is that you have an annual wellness visit, you have a welcome to Medicare exam. Maybe that's an opportunity, because you're not seeing those patients.
Oh, yeah, no.
Maybe you'll know that, okay, this is a patient of Dr. Dallas. Maybe you can call Dr. Dallas's office and say, can you send over the, who knows. But I think that sounds like what you're really hoping for is a regular conversation.
Yes, you want to keep that as up to date. You have to renew your car insurance every year. You have to renew your house insurance. You should renew these forms as well.
Oh, that sounds like a great place to keep an advance directive, or at least a copy of it, in the glove box with your registration papers. So, like our advance directive that names a power of attorney agent would have our office phone number on there. It has the people. Should it have the people's phone number, like a contact information? Like when I say people, the agent.
Yes.
Yeah.
I would appreciate
some way
that.
To keep it on there.
Yes, because if you are incapacitated and it says, my healthcare power of attorney is going to be Love Anani, if I can't contact Love Anani, that information doesn't really help me. So either a quick number, 1 or 2. I know you can't list everyone.
You don't want to be Facebooking them or
exactly.
something like that.
It's not the time.
Trying to find them.
We have done that before.
Oh, is that right?
Yes, Google, Facebook, whatever we can do to make sure we're doing the right thing to get you the care that you would appreciate.
Right.
We've got 1 minute left. We're going to put your contact information up. Any cautionary tales that you want to share with the audience?
I will say we've talked about it, and I want to reiterate it with a tale. As a emergency room physician, I have seen patients who updated their form, or at least updated with their wishes to the healthcare power of attorney, and did not update their form. So then we have a form that says do not resuscitate and a power of attorney that says do everything possible. It can be very difficult when other family members show up. So make sure you please get in contact with your lawyers, your healthcare power of attorneys, anyone in your family. Make sure they know your wishes.
In short, it's called communication.
Yes,
And
to
goes a long
everybody,
way.
the
Yes.
people that need to know. All right, that wraps up our year in review show. It's been a pleasure to spend the time with you for the past 3 years.
Yes, it has been a pleasure to bring new topics and information to you. You can continue to see Tim, myself, and our new partner, Chris Johnson, on Morning Line and Open Line once a month. And in the meantime, be on the lookout for our Aging Starts Now podcast. And we'd appreciate it if you'd follow us on Facebook. Thanks.